Hello, my name is Taylor and I am going to be administering some medicines through a feeding tube today. So the first thing I'm going to do is check my order, make sure I have my right medications, which we have ordered Lotensin 20 milligrams and Lasix 20 milligrams. And typically when you do it through a feeding tube you would want to get a liquid preparation, but there are none available in the pharmacy. So what we're going to do is we're just going to get the meds out and crush them and put them in here, which I've already done for time's sake. And you want them into a fine powder so you can easily dissolve them. So I'm going to go into my patient room and introduce myself, get her name and date of birth. I'm going to check to make sure she's not allergic to the medications that we're giving. Also, I checked to make sure that the medications were compatible with each other so I could crush them together and give them together. And then I also checked to make sure they're compatible with the enteral feeding to make sure I don't need to hold the feeding, which I don't need to. So the first thing we're going to do is we're going to make sure that the tube is placed. We can get some residual, check pH, or insert a bolus of air to make sure that and listen for air bubbles in the stomach. So next I'm going to wash my hands and put on gloves. Okay, and I'm going to pull out her gastric contents. So I want to pull all of them out. If there is more than 200, I'm going to discard all but 200 of it and put 200 back into the stomach. If there's less, I'll put it all back into the stomach, and then I would record all of anything that I discarded in her I and O. And next I'm going to flush the tube to ensure patency. I'm going to do 30 mils and flush it. And I'm going to mix up probably about 15 to 20 mils in the medication to make sure we get it good and dissolved. You want to use normal saline, and it works better if it's warm. It helps dissolve the medication better. While I'm doing this, I'm going to tell my patient that the Lasix can cause blurred vision and some GI distress, some nausea, vomiting, and that it's going to help remove fluid from her tissues and make her pee a lot. And I'm going to tell her that the Lotensin is for her blood pressure and it can cause hypertension, so I want to check her blood pressure and make sure it's not already low. And it can also cause a cough, and I would let her know that it's for high blood pressure is the purpose of the drug. So I'm going to administer my med. And you want to do it kind of slow, you don't want to push fast. And then I'm going to flush again with another 30 milliliters. And then I would record all of this in the MAR, and I would also record her I and O, how much I put in. And I'm going to make sure I made sure that I had the 6 rides, so the right dose, the right route, the right patient, the right medication, and the right time. And I think that's it. I'm going to make sure that my patient, the tube is all back together, and hook it to the patient so that it's not hanging on the floor. And I think that's all.